LearnAsia was started in 2004, September. And we began as a regional research organization based in Sri Lanka, but we continually wanted to work throughout the region. So we've always been interested in the idea of comparative analysis, of learning, taking the learnings from one developing country to another. The whole idea is the basic principles, the basic theories are valid all over the world, but when it comes to policy and we bring them down to the country level, we had to take the country's realities into consideration.
Basically, an individual spending less than 13,777 rupees per month considered as a poor individual at national level. Assuming 4 members per household, this roughly translates to about 55,000 rupees per household. So, with that government definition, our survey data indicates that around 7 million people in Sri Lanka are living in poverty as of 2023. Which means a third of the population is below the poverty line. So this roughly translates to about 2 million families living below the poverty line. We can see that 4 million people have fallen into poverty. So in other words, the poverty head count ratio has doubled from 2019 to 2023. Also, poverty has doubled in rural areas and the poverty has tripled in urban areas. As per our survey data, we are seeing people are taking quite drastic steps to, just to survive on another day. We observed 1/3 of the households are eating fewer meals a day. That means they are skipping meals. Another third restricting adults' food consumption to allow their children to eat.
We'll focus on Samurdhi, which we are all very familiar with, and we'll see that of the 2 million families that were below the poverty line, only 32% of them received Samurdhi. So this is very concerning. 1.7 million families that received Samurdhi, only 40% were poor. Even amongst the poorest 10% of households, only 31% received Samurdhi. Meanwhile, of the richest 10% of the households, 4% did. So we're dealing with a misallocation of resources. This is what we saw in the case of Amaravira, who's a retired mason who we met in Polonnaruwa. He said that he only started getting Samurdhi after he started going for political rallies. And unfortunately, this is a narrative that we hear time and time again. And before COVID, we found, and the economic crisis, Sri Lanka spent less than 0.4% of its GDP on social safety nets. And this was a lot less than the peers who had similar levels of poverty. But now we can see that our expenditure on social safety nets is increasing. And we've seen more money was allocated for social safety nets in our budget, and the IMF program also requires us to spend a larger portion of money on social safety nets. So we're seeing a positive trend in this way. But there were 2 things that stood out for us. One is that the Aswasuma provides differentiated benefits based on the level of vulnerability. So those who are most severely poor will get 15,000 rupees, for example, while those who are deemed just vulnerable will get 5,000. So this indicates that the benefits also are guaranteed only for a certain period of time, which is quite different to what we saw where people, receive it for 10 to 28 years. So these are the big things that we saw Aswasuma being quite different to what we had seen earlier in terms of Samurdhi.
Look at the names, it was earlier Janasavya, and then it became Samurdhi, and now it has become Aswasuma. So, comparing the poverty numbers, which was shocking, where 4 million people have, joined or fallen back to the poverty, and the names have changed, but the poverty numbers have increased.
Even though your finding reveals that the Aswasuma covered only 53% of the poor in our program, but when we compare about the Samurdhi one, as you reveal, it was 31%. So nearly about 22% increase on the verge of starting our process. That means we can by and by improve the coverage and the target. So in this context, I think our program would be very successful one and yet to be improved with the learning we collected in the exercise of the program.
We are in a situation where there is new poor in areas that were actually progressive. So now we have to deal with a productive group of people who have now faced a very difficult situation. So there is a difference between people who were actually in need of support on a regular basis, and now there is a group who just need to be supported in a short period of time. So we also need to understand that the kind of support that those two groups need is different. So we need to also kind of think whether there is a group that needs productive support, and whether that really is a need that requires 2,500 rupees, or whether they should be supported in more entrepreneurial, productive support.
Thank you very much.